Next, on the surgical diseases of the urogenital system, we'll be talking about the kidney tumor. And coming from now, we spoke about bladder tumor. We also spoke about bladder cancer. All right. So we'll talk about kidney tumor, and of course, we'll still talk about kidney cancer. All right. So you see, we have the two concepts in the same video. All right. So our focus, our focus is always different from the heading. Okay. So our focus is to discuss kidney tumor and also talk about kidney cancer, because kidney tumor is basically like kidney cancer, all right? Because the tumors will actually develop into the cancers, okay? So this is a kidney cancer or kidney tumor. Basically, there's an abnormal growth of some cells, all right, in the kidney. It could be the kidney cells that are actually growing abnormally. It could be that the kidney cells have actually lost coordination. There's no growth rules that this cell, you're supposed to grow to this level and stop. Okay, so basically, this is like there's no coordination in the growth of some cells in the kidney. All right, so these cells will hypertrophy. That means like they overgrow, and you understand, resulting into what we call kidney cancer. So talking about kidney cancer, we'll be talking about the definition, we'll be talking about the types of kidney cancer, we'll be talking about causes of kidney cancer, and the causes. From causes, we'll be talking about symptoms, and we'll be talking about treatment, all right? And that will be all for tonight. Right, so guys, kidney cancer, the definition, is that a kidney tumor is an abnormal growth of tissue that may be either cancerous, that's malignant, or non-cancerous, it can be benign. Okay, so let's delve into some points about kidney tumors, all right, or you could say kidney cancers, all right, because definitely the benign tumor will actually lead to the cancerous tumor, all right. So now, what are the types of kidney tumors? We have renal cell carcinoma, and this is the most common type of kidney cancer in adults. It originates in the cells lining the small tubules within the kidney. Okay, so it's basically affecting the cells of the kidney. Okay, then other types of kidney tumors. We see that less common types of kidney tumors include what? Transitional cell carcinoma, Wilms tumor, which usually affects children. We have oncocytoma. Okay, now what are the causes and risk factors? The exact causes of kidney tumors remain unclear. Okay, but certain factors can actually increase your risk of actually having a kidney tumor or kidney cancer. All right, and these factors include what? Tobacco use. For people who smoke, okay, if you smoke or using tobacco products, okay, it mustn't be only smoking, all right. There are some tobacco that people actually take through the nose, that's a snuff. It's still tobacco, right? And you are still at the large risk of actually having a kidney tumor or kidney cancer. Then alcohol consumption, say that regularly consuming more than 7 alcoholic drink per week may contribute to the kidney tumor. Now, for me, the advice I always give people is, if they are advising you against taking something in little amount, then you actually need to stop taking that thing at all, right? So this is how a kidney tumor could look like, all right? Some cells of the kidney are actually growing without rules, okay? They are just growing anyhow, right? Obesity. People who are obese or overweight are at an increased risk of actually having kidney tumors. Then family history. We said that having a family history of high blood pressure or kidney tumors, that means you too, you are at the risk of actually having these kidney tumors. Then chemical exposure. We see that regular exposure to chemicals, okay, containing chlorine, can actually lead you to having these kidney tumors. Then demographics. We said that certain groups of people, it could be older individuals, it could be males, it could be Black Native Americans, it could be Alaskan natives or First Nation populations, all right, are at the more risk of actually having kidney tumors. Now, what are the symptoms? So that many kidney tumors are asymptomatic and are often discovered incidentally during testing for other health conditions, right? So the patient can actually come to the clinic with a different uh, health problem, right? But in the process of you taking all those MRI scan, CT scan, or even from the history, okay, you can suggest or you can suspect that the patient will actually have a kidney tumor or a cancer of the kidney. All right, then from there you can actually discover it. Okay, so now some symptoms may include blood in urine, okay, because there's a tumor, so it is affecting the cells. It's definitely affecting the blood vessels self too. Okay, so now you can actually have blood in urine too. Okay, if you have kidney tumors. Then there's pain between the ribs and the hips. That's a flank pain. It has pain in the left upper quadrant or pain in the right upper quadrant. Then there's lower back pain, there's loss of appetite, there's unexplained weight loss, there's fever, and there's anemia. Now, why is there anemia? There's anemia because erythropoietin is produced in the peritubular cells of the kidney. All right. So now, if the cells of the kidney is being affected, then erythropoietin, which is meant to trigger the process of erythropoiesis, is being affected. Okay, so this is you can see this is a normal kidney, and this is a kidney with a tumor. All right. Now, what are the possible treatments of kidney tumors? You said that treatment options depend on the tumor type or tumor size, okay, or how long, all right, this tumor have actually been around. So it could be that some people they had these tumors, they were seeing blood in their urine, but they neglected it, okay, till it got to the worst of worst. Okay, so treatment depends on the level of the tumor. So surgery could be a treatment option. We said that surgical removal of the tumor, that's like partial nephrectomy or radical nephrectomy, could actually help this. Then other therapies like targeted therapies, immunotherapy or radiation therapy, that's you trying to use all those radiation, those x-rays to actually kill the tumors. Do you understand? Then monitoring. For small non-cancerous tumors, close monitoring may be recommended. Now, what is the prognosis? All right, what is the overview conclusion on this? We see that early detection and treatment of these kidney tumors will actually improve the outcomes. Benign tumors generally have a good prognosis. That's a good possibility of healing. Do you understand? That's what prognosis means. Malignant tumors prognosis varies based on the factors like the tumor size, basically the stage of the tumor, right? Have you had this tumor for a long time and you have neglected it? Then definitely you know that um you need like how will I put it? A more advanced way to actually deal with it, all right? The longer you leave it, the harder the chances of actually getting it solved, all right? So guys, that's it about kidney tumor and kidney cancer. Talk about the types, talk about the causes, spoke about the symptoms and the treatments. Okay, so bye for now.